Hi, my name's Anita Jutley. I'm a dental associate working for the Infinity Blue Dental Group. I've been asked to talk about my experiences with Kenya, my links with Kenya, the work that we do out in Kenya, and the future plans that we have in Kenya. So my links with Kenya go as far back as I can remember. My parents were actually from East Africa, Kenya. They had their upbringing there, and even to this day, we still have links to Kenya through families. My parents left Kenya in the late 60s. They migrated to Great Britain, and this was at a time when there were a lot of people leaving the country after Kenya gained its independence in the 60s. There was a mass exodus of people from East Africa going to other parts of the world, and my parents were part of this group that were leaving the continent. My mum was the only sibling in her family that actually left the continent at this time. She left her parents behind, her other siblings and family members. My parents arrived in London in the late 60s. I was born and brought up in London, southeast London. I schooled in London. I went to university in London. I started my dental career in London. But throughout my childhood and my early teens, I used to visit Kenya very frequently with my family because we still had family out there. So my links were still very much there. And it was great. I still have very memorable trips of Kenya. With time, obviously, people passed, grandparents passed, people moved away from the country. So my links started to kind of dwindle a little bit. So after I qualified, ironically, I met my husband, Raj, who ironically is from Kenya. And that enabled me to re-establish my links with Kenya very strongly. My husband, Raj, he came over to the UK in the 90s to study medicine. So he had done his schooling in Kenya and then studied medicine in Aberdeen University. He then progressed to become a cardiac surgeon, which then led us to Nottingham, which is where he got his consultant's post for many years. And at that stage, I had just had my fourth child as well. So we were a young family, 4 kids, but this calling he had for Africa was very, very apparent. He always had that urge to go back and to give back to the country where he was born and brought up, and a country that he still very much loved. And obviously having his family out there as well, there was still that desire to go back. We moved everything to Kenya. We arrived in 2010 and we basically started our lives in Kenya. My husband got a consultant's job in the Aga Khan hospital in Nairobi. I managed to get myself a dental job in Nairobi. So we were both working. But Nairobi's a busy city, traffic, noise, it's like any other city in the world. We love the countryside, so we would routinely go out at weekends, go off weekends and explore Kenya for the country it is. So every weekend we would haul the kids into our old classic Land Rover. We had a bushwhacker camping trailer that we would haul around, on the Land Rover, and we would explore every part of Kenya, which was amazing. We'd do this as a family. Occasionally we'd have friends with us. So it was always fun. Memories that we'll always, have. And more importantly, it's the memories the kids will have when they grow up. And we're all back in the UK now, but I think these trips and the memories they have of these trips, they will never forget. And they will, I think, treasure them for the rest of their lives. So we had some great times traveling around Kenya, saw huge amounts, more than what we expected actually. And we loved the landscape. We went to probably every reserve in Kenya, tried to see as much wildlife as we could. And we just grew more and more in love with the country. So that was the plus side of Kenya. I mean, it was fascinating. But on our travels, it became really apparent the lack of medical facilities and healthcare that there is around the country, particularly around the rural areas. Nairobi is fine. It's got hospitals, it's got private healthcare, it has some government hospitals. So in Nairobi, people do have access to medical care. Even the ones that aren't so well off, there is facilities for them. However, in the more rural parts of Kenya, people do not have access to medical and dental care. And when we got talking to some of the people in these areas, they would literally plead with us. They knew what we did as professionals, and they would literally plead with us to do something to help out the community or help establish something where people can access basic medical and dental care. My husband, his goal in Kenya while he was there was to set up a medical facility to provide healthcare for the underprivileged in Kenya. And that did actually happen. He did that very successfully. But again, it was a Nairobi-based institute. So it wasn't reaching out to the rural communities. So what he did was successful, and it worked, and it's still working, which is amazing. So after many years in Kenya, after this hospital was running and still is running, we thought we still had to do more for more people in Kenya. And what we did, we wanted to make this a fun thing as well. So my husband is a traveller, and he doesn't stay in one place for very long. He loves exploring, he loves travelling. And he wants to explore the world. And he's managed to do a lot of it on his motorbike, and he's still got a lot to do. But he wanted to try and set something up which combined his passion and something to help the communities at the same time. So what we decided to do was set up something that would allow us to combine our passions and helping the rural communities. We are fortunate enough to have a house in Kenya, in Kitengela, which is quite a rural part of Kenya. It's just on the outskirts of Nairobi, far enough away to call rural, but close enough to access facilities if we need to. I've been back in the UK for a number of years now. The kids are finishing their higher education. In fact, most of them have left school now. I've still got one in secondary school, so I'm just waiting for her to finish. But even during this time in the UK, I've still managed to go back and forth and be part of a project that is helping those communities in Kenya that we intended to help. And I've been very fortunate enough that Infinity Blue have been able to fund a few of these projects that we carry out in Kenya. It's been amazing that members of the Infinity Blue Group staff have been able to come out with me to Kenya on a number of occasions now and help out with dental talks in local schools, food programs that we run in the schools, sanitary towel projects that we do for the young girls and women out in the communities, which is a very important thing. And I think in total we've done about 5 trips so far with members of staff. They've loved it. They've had an amazing time. And what we tend to do, we base ourselves at our house, and we have 3 schools in particular in the area that are needing a lot of help. So we delegate 3 days and possibly a bit more if we can to actually go out to these schools and have oral health talks to the kids. We also give them toothbrushes and toothpaste that people have donated to us through the group. And it's fantastic. And the kids are just absolutely ecstatic when we come to visit, and they never forget when we've visited even just once, they will remember everyone's names, and when I've gone back, they'll always ask about the people that have been previously. So they never forget. They're always so happy to have people to come and talk to them. So that's one thing we do. Like I mentioned before, the other project that we do is the Sanchichao project. Yeah, so the Sanchichao project is part of the few things that we run from the centre. The girls go away with a sense of empowerment after learning how to manage themselves during this challenging time, and there is a stigma attached to women on their periods, and it's something that obviously we're trying to eradicate, but these things take time, and I just think with our efforts and with more knowledge, and if we can spread the knowledge and the information to people, this will hopefully become a thing of the past. And I think it will require a joint effort, which is why part of this video is really to give people an idea of what's going on, and actually, more importantly, to know that they can actually help. We are running the PANAF charity. Obviously, financial donations are amazing. If you wanted to physically go out there and help run classes for the kids, do dental health talks, help with the food programs, the more the merrier, and every little bit helps. The other projects that I mentioned was the food programs, and our aim is to be able to feed the kids of these 3 schools in our area lunch at least 2 to 3 times a week. Their staple is rice and lentils. It's called dengu in Kenya, and it's a staple for them. Very nutritious and very filling, and will keep them going for like a number of hours. We're trying to encourage donations for the food programs as well. The other project that we run is we're trying to prevent FGM, which is female genital mutilation. It's something that has been happening in Africa for centuries. It's a cultural thing. Globally, it's trying to be stopped, and we're trying to eradicate this part of the culture that is doing this to young girls. It's really sad. It has a lifelong effect, obviously, on the girls, and a part of them is taken away from them. So our part of the donations and the profits we make from the camp are going towards this, towards prevention of this act, and trying to get laws and get more security for the girls, basically, to prevent this from happening. We've basically recently opened up an overlander centre. It's an eco-camp for overlanders to come and stop on their travels for R&R, a comfortable bed, nice food, washing machines, washing facilities, and so forth, so they can, so they're fresh for the next part of their journey. A lot of overlanders will start their journey from South Africa and do the whole of the East African coast, and a lot of them will stop in Kenya and head back to South Africa. So South Africa is normally the starting point, and Kenya is the final destination. We're situated at the border of the national park. There's no physical barriers between the park and where we live, so animals freely come back and forth from the park. So quite often in our territory we will see zebras, giraffes, rhinos, hippos, occasionally lions. We see them all. So it's a lot of fun. If anyone is interested in having an experience and actually knowing they are helping, we are very, very happy to have people come over, stay with us, help with our projects, knowing that they're helping people, but also enjoying the country and seeing Kenya for what it is. Please get in touch. We have links that you can go on to if you want to donate, or you can contact us directly if you want to actually come out and help us, and the more the merrier.